In today's video, I'm going to be talking about celiac disease and other digestive disorders. Now, if you suffer from celiac disease, you'll be only too well aware that it often gets diagnosed as irritable bowel syndrome, inflammatory bowel disease, or even Crohn's disease. So today we're going to discuss all four. So do stay watching. Hi, I'm Mike Hines from JustKnowGluten.com, creator of this channel, Gluten Advice. If you like the content, you like the video, why not give it a like and subscribe to my channel. Also, hit the notification bell down the bottom. That way you'll be informed at all times when we post new content on this site. We post videos 3 times a week, Monday, Wednesday and Friday. So do pop back from time to time. We'd love to see you and you're always welcome. Okay, let's get straight into the content. Celiac disease is also known as sprue, non-tropical sprue, or gluten-sensitive enteropathy. Celiac is sometimes spelled as C-O-E-L-I-C, which in fact is the correct spelling. Celiac disease occurs to people who cannot tolerate the protein called gluten, which is found in barley, wheat and rye. Celiac disease is a pretty common digestive condition where the small intestine becomes inflamed and unable to absorb nutrients. It can cause a range of symptoms including diarrhea, abdominal pain and bloating. Celiac disease is caused by an adverse reaction to gluten, which is a protein found in cereal. Gluten is found in any food that contains the above cereals, including pasta, cakes, breakfast cereals, most types of bread, certain types of sauces, and some types of ready-made meals. It's also found in most beers, which are made from barley. Celiac disease also has a number of more general symptoms, including fatigue as a result of not getting enough nutrients from food, unexpected weight loss, an itchy rash, problems getting pregnant, nerve damage, and disorders that affect coordination, balance and speech, which is called ataxia. Children with celiac disease may not grow at the expected rate and may have delayed puberty. Celiac disease is an autoimmune condition. That is where the immune system, the body's defense against infection, mistakenly attacks the healthy tissue. In celiac disease, the immune system mistakes substances found inside gluten as a threat to the body and attacks them. This in turn damages the small intestines, disrupting the body's ability to absorb nutrients from the food. It's not yet clear what causes the immune system to act in this way, but a combination of genetics and the environment appear to play a part. We need to understand that celiac disease is not an allergy or an intolerance to gluten. The bad news is there is no cure for celiac disease, but switching to a gluten-free diet should help control the symptoms and prevent the long-term consequences of the condition. There are several other digestive disorders that are often confused with celiac disease, like irritable bowel syndrome. Irritable bowel syndrome, or IBS as is known, is often confused with celiac disease. IBS is considered to be the most common disorder. In North America alone, there is about 20% of Americans believed to have some form of IBS. Now, the treatment for IBS is not the same for celiac disease patients. Sometimes celiac disease patients do not always get the appropriate treatment, and the diagnosis seems to take a long time. Patients with IBS should ask their physician or their doctor to make sure that they don't have celiac disease. Medical researchers in Britain have found a high rate of celiac disease with patients who have IBS. The British study also found that the chances of having celiac disease was 7 times higher for patients with IBS. The causes of IBS are not well understood. There are several studies made saying that it has something to do with the central nervous system. There are changes in the nerves that control sensation or muscle contractions in the bowel. The bowels of the intestine contract irregularly, meaning that the food is pushed either too quickly or too slowly. IBS effects are more likely to be emotional rather than physical. Some IBS patients find it difficult to lead a normal, happy life while experiencing the digestive disorder. But people with IBS have been found to have a lower chance to develop more serious or life-threatening bowel diseases. Although this is definitely good news, it does not mean that serious diseases cannot occur separately. Another digestive disorder is the inflammatory bowel disease. This is the name of a group of disorders that cause the intestine to become inflamed or red and swollen. This inflammation lasts a long time and usually comes back over and over again. The disease can be caused by either a germ or an immune system problem. The disease is not contagious. Inflammatory bowel disease, just like celiac disease, does seem to be hereditary. Another problem for celiac disease sufferers, celiac disease is also misdiagnosed quite often as Crohn's disease. Crohn's disease is an inflammatory bowel disease, IBD. It causes inflammation of your digestive tract, which can lead to abdominal pain, severe diarrhea, fatigue, weight loss, and malnutrition. People of all ages can be affected by Crohn's disease. The symptoms usually start in childhood or early adulthood. The main symptoms are diarrhea, stomach aches and cramps, blood in your poo, tiredness, and weight loss. The symptoms may be constant or may come and go every few weeks or months. When the symptoms come back, it's called a flare-up. Inflammation caused by Crohn's disease can involve different areas of the digestive tract in different people. Crohn's disease gets treated depending on the status of the gastrointestinal tract. When the disease is mild, medicines may still help. But in severe cases, steroids are generally used. There are times that even surgery may be necessary, but it cannot cure the disease. There are about 95 million people in the world affected by digestive problems every day. Digestive disorders are one of the primary reasons for physician visits. It is important to get medical attention for digestive disorders since digestive diseases are very complex. The symptoms may be subtle and their causes may be unknown. Identifying or reaching a diagnosis needs a thorough and accurate medical history and a physical background since some digestive disorders can be hereditary. If we want to reap what we eat, then we should take care of our digestive system. A digestive disorder or digestive disease like celiac disease is impossible to ignore. Ignoring celiac disease and other digestive disorders means ignoring our total health, and that could eventually threaten our lives. Hello, I'm Mike Hines from JustKnowGluten.com, creator of this channel, Gluten Advice. Thank you for watching today's video on celiac disease and other digestive disorders. I do hope you found it informative and helpful. If so, why not give it a like, subscribe to my channel. Again, thank you for watching, and I shall see you in my next video. Take care, bye bye for now.